All right, welcome everyone. Thank you so much for joining us today. So, I'm Jordan and I'm from Folia Health, and we're so excited to be here with our very first PNH patient panel today. So before we get started, I just wanted to share something that we're doing in PNH for anyone who might be interested in this. We are currently running an observational study. It's fully remote, doesn't require any specific treatments, any doctor's visits, any appointments. All you have to do is track how you're feeling, whether your symptoms are active or not. It's so if you're feeling good, which is amazing, that's also totally fine. You can still participate in the study. And the goal of the study is to help researchers understand where current treatments are falling short and how we can help improve the quality of life for people living with PNH. So we will send over the link in the chat with a little bit more information if you're interested in joining. But that's just one piece of it. For the main event today, I would love to shift gears, and we have our four incredible panelists with us. Each of these ladies has their own unique journey with PNH, including different treatment plans. And so throughout today's conversation, we'll learn a little bit more about their stories and what that looks like for them now. So we'll do a quick round of intros. So I'm just going in the order that I see people on my screen. So this has nothing to do with anything, but we'll start with Brandi. Do you mind just giving us a little intro of yourself?
Yeah, so hello, my name is Brandi Lewis. I have been battling PNH since 2016, so I was 27 years old when I was diagnosed, and I was also diagnosed with aplastic anemia at the same time. But now I live in Alabama and working in corporate America, so working and living with PNH has its own battles, but I'm actually doing it, so that's it's going good for me.
Awesome. Thanks, Brandi. And we'll move next to Gail.
Hi, my name is Gail Mahalik. I live in Wisconsin. I was first diagnosed in November of 23 at the age of 59. So,
Awesome. Thanks, Gail. And Jeri?
Hi, I'm Jeri Keeler. I live in San Diego. I was diagnosed in 1984, and after being pregnant and having blood tests, and so I've had PNH for 40 plus years.
Gotcha. And Selena.
Hi, I'm Selena. I'm from Washington, and I was diagnosed in 2022 with both aplastic anemia and PNH. And I just had my first baby, and he is 4 months old now.
Amazing. And so I meant to say this in the first part, so we'll just go around one more time. But do you mind just sharing what the treatment you either are currently taking or that you had was? And we'll go back to Brandi.
Yeah, so for me, since I was diagnosed with aplastic anemia and PNH at the same time, I was actually in remission from aplastic anemia when I was diagnosed again in 2016. So the first time around of just battling aplastic anemia, the type of treatment I had was called ATG. It's a type of treatment that I was in the hospital for 5 days intravenously. They dripped this bag of liquids for 12 hours a day. And there are two types of serums that you can have. There's a rabbit or horse serum. It's actually funny because it actually comes from a rabbit or a horse. The first time around with aplastic anemia only, I had the horse serum. So we decided to do the same type of treatment to treat aplastic anemia and PNH in 2016, but we changed it up and did the rabbit serum.
Gotcha.
So my journey is a little different with the treatment plans.
Thanks, Brandi. What about you, Gail?
when I was first diagnosed, I started with the Ultomiris infusions every 8 weeks. And I only had 3 infusions, and then my hematologist switched me to the Fabhalta, the oral, twice a day. And I've been on that since April of 24.
Okay,
So
gotcha.
about a year
Oh, yeah,
now.
about a year now, huh? Awesome. And Jeri?
When I was first diagnosed, I also had aplastic anemia before they diagnosed me with the PNH, and I also had ATG, but I was in for 10 days, 24 hours a day. So the treatments have changed. I also then took testosterone, which is why my voice sounds so bad. I used to be a soprano. And and then I took prednisone for many years, which helped keep my red cell counts up, and my platelets were pretty stable at about 140,000. So I just been on prednisone for about 15 years so I'd feel better. And I decided that was more important than worrying about the side effects of prednisone. Then I stopped the prednisone. I don't have aplastic anemia anymore. I have had PNH since 1986. I went on Solaris for about 15 years, and then no, 12 years. And then last year I decided to switch over to Ultomiris, mostly because I don't have to go as often, but I don't think it works for me as well. But, as far as I can tell, all of the counts are down, and that's good. And that's, as far as treatments for PNH, that's all I do now.
Okay, gotcha. And Selena.
And so since I as well was diagnosed with aplastic anemia and PNH, mine was severe at the time, and I was very blood transfusion dependent. And so I went straight to a bone marrow transplant, which included chemo, radiation, ATG, and then the marrow transplant itself. But yeah, everything's been really good. Now I was on quite a few medications for about a year post-transplant, but now I'm completely medication free, and doing really good. And all my blood levels and counts and everything are really good.
Oh,
Wow.
so glad to hear that. All right. Well, thank you, ladies, so much for sharing all of those different treatments and the treatment journeys too, because some of you are on several. I think now we'd love to hear, like what was that experience like for Brandi going through ATG? You shared a little bit, but we'd love to hear, even if you're open to it, sharing a little bit about the emotional toll that it took on you, the physical tolls, kind of some of those things that you learned, I guess, on your journey.
I always say, battling a chronic illness, you battle it mentally, physically, and emotionally. So for me, I'm pretty open about every area of how I've battled both aplastic anemia and PNH. Just because I started out just with aplastic anemia alone, I was a sophomore in college, so my life was turned upside down of taking medical leave from college, trying to only focus on my health. And as a sophomore in college, that's not the first thing on your mind is your health. So it's definitely something that mentally takes a toll just because your life changes instantly and you're having to now battling and deal with something in your life you never thought you would. So I am very open about that as well, and going to therapy and getting that help as well. But as far as physically battling aplastic anemia and PNH with the treatment of ATG, so like I said, I was in the hospital for those 5 days, and it was just very tiring. I was tired all the time. There were times where of course, they make you get out of bed and walk every day, just to kind of get your blood flowing. But those days are days I didn't even want to, get up and do that. But after getting the treatment of ATG, it took, I would say, a full year to actually start to see the progress of actually seeing my blood counts go back up. And then also with that, I was taking an oral medication called cyclosporin. So with cyclosporin as well, and I think at one point I was taking like almost like 30 pills a day is what it was at one point, for that year after having ATG. So it wasn't just the ATG, but that was the main treatment that I had. And for me, it was the patience. I had to learn to be patient within the journey, because, I wanted to go back to my regular life. I wanted to go back and work and just get this over with. It was really my mindset in the beginning. And then I understood that, okay, this is something that I will be battling for more than a year. And so I really learned to be patient with it. And just really, what helped me mentally was journaling. Just really journaling. It didn't even have to be full sentences. Sometimes it was just thoughts that I was having. I would journal. And it's funny because sometimes I'll look back on those journal writings that I've had and experienced, and I see how far I've come just from the thoughts that I had at that time. So that's a little bit of things that helped me also during that time.
Oh, that's such a good reminder of how important it is to prioritize your mental health and And
Yeah.
that's a great tip too, just to write things down and then to go back and look and see. You can like literally see the progress that you've made, which is pretty incredible. So thank you for sharing that with us.
Yeah.
Oh, I see Selena's little fave down there.
Yes.
Guest appearance. Awesome. And I was gonna ask you too, Brandi. You mentioned that you realized you needed to be patient, whereas your first mindset was like, I just want to get this over with. And was there anything in particular that helped you get to that point through the journaling, or was it through some other thing that happened?
For me, in the beginning, I was just sulking. And it was like, I'm wasting so much time just being like frustrated and angry and questioning why me, from the beginning. And so the second time around, when I found out that I was out of remission with aplastic anemia and diagnosed with PNH, I said, okay, I'm going to take the weekend to just sulk, cry everything out, feel all the feelings. I think that's very important to not just push everything down. And so I did that for a full weekend, Friday to Sunday. I watched movies, ate ice cream, sat in my bed all day in my room, and I just sulked. And Monday morning, I had an appointment to go back and to figure out the next game plan, and I was ready. But I think what really helped me was really having that time to feel all the feelings, but again, not staying there. So giving myself like a deadline of, okay, 3 days, feel all the feelings, but we're going to get up and we're going to move forward because my life depends on it for sure.
Oh, wow. That's such a good tip too. Thank you for sharing that. I think
Yeah.
that's really helpful. Amazing. And Gail, we'd love to hear about your journey too.
Okay. I feel like I had pretty easy so far. I mean, my main symptom was my platelets were dropping, and um, I was referred to hematology in 22, I believe. And then she just kind of watched my platelets because everything else was normal. And then they dropped to like below, like in the 80s. So then she did a bone marrow biopsy, which was normal. She had thought maybe I had leukemia. And then I told her that I had had some symptoms like a few months back. This was like in October of 23, that I had some like dizziness, like some numbness and tingling sensations, cold sensations, and some shortness of breath at times too. And I have a brother that has AFib. I was kind of putting it up, maybe I have AFib too. But so then my hematologist did a bunch of different tests, and she did PNH tests, and it came back PNH. So she started me on the Ultomiris. I had those 3 doses, and then I've been on the Fabhalta, and I mean, I still have mild symptoms, not as bad at all like they were, because I mean, I was to that point, like I felt like I was going to pass out at times and stuff when I was getting real dizzy and lightheaded. And but since then, I mean, I do have mild symptoms, but I don't really have. I still work full time. I've been an RN for 38 years now, so yeah, it's been. My biggest challenge has been this. It started yesterday when I went. I have my hematologist appointment on Thursday, so my day off is Thursday. So I had my labs drawn yesterday, and my platelets are 8. So I had to go the only thing I have is the bruising, no bleeding or anything, and I've been having bruising because my platelets, the lowest they were before was 37. They've been in like the 30 to 50 range. Well, then they were 8 yesterday, so I had to leave work and go have a unit of platelets infused. And now I have a PNH specialist through Mayo Clinic, also Dr. Dingley. And my hematologist in town, my local hematologist, contacted him, and he wants me to have 2 consecutive days of IVIG infusions. So I have my appointment Thursday, and she said depending on my levels on Thursday, I'll either have the IVIG Thursday, Friday, or also wait till Monday, Tuesday of next week. So that's my first real challenge I've had. So
It's so fresh too. Thank you for being here today with all
Yeah.
of that going on and for being willing to share that with
welcome.
us.
So
Yeah. I am curious, you did the 3 infusions and then switched so quickly to the Fabhalta. What kind of, did anything factor
she,
into that choice?
um, my hematologist felt I was having like extravascular hemolysis also because my bilirubin and liver
Gotcha.
levels were elevated, and they've come down since I started
Okay.
the Fabhalta.
Okay.
Okay. Thank you again, Gail. And Jeri, you've had a slew of different treatments. So
Well,
would love.
yes, because 40 years gives you a lot more options. So I actually was diagnosed. I went in for a blood test to confirm I was pregnant, and literally that afternoon, I got a call from my doctor saying I have to go to the hematologist today. And of course, that scared me. You never get into a specialist a day; they want you to. So that's when they diagnosed me, and they after they had to end the pregnancy right away. They knew that it wasn't viable. They they made me wait to see if I would get better for about 8-10 weeks. And by the time I got to the hospital, because my heart rate was so high, my platelets were also down to 8,000, and my red cell count was minimal. Never had a problem with my white cells. So interestingly, but when I was taking the ATG, I felt great because they'd given me a blood transfusion, because they wouldn't give me a blood transfusion because they didn't want to mix up the symptoms. So I got the blood transfusion and I felt 100%. So during the time I had the ATG, I didn't feel that badly. So that was good. Although it's very boring to sit in a hospital for 10 days. There's not much to do. And stare at the four walls. I couldn't read. Like Brandi was saying, your brain's fogged. You can't really concentrate on anything. Kept falling asleep. But interesting. So in my case, I went home on Christmas Day after the 20 days of being in the hospital. And because I said 10, but I was in the hospital 20 days. And literally a week later, my count started to go up. So there's still some question whether the ATG even would help, because that was an awfully quick response to it. And so now my platelet counts are at 130,000, so well within the range of acceptable. But those were my first things. And the hard part for me was I'll pat myself on the back for a second, but I was a partner in a very large international CPA firm, working hard to get there. Just was promoted. I was going to do my best. Even when I was feeling crappy, I would try and drive myself to work or take a taxi. And so all of a sudden my job was taken away from me too. And so for me, even though I was married, it was my identity. And that was really hard for me to figure out who I was going to be after that. I knew I couldn't have children at this. It was from a psychological mental state. That was where I was having a problem figuring out who I was. I guess I wasn't that scared of dying, because that was a high percentage chance in those days that I wouldn't make it. I was much more worried about my family, my parents, my sister, all the people that were still around me, my husband. And I spent time worrying about their feelings more than my own, because they were suffering in a way I wasn't.
Wow, that is so much to like, have to wrap your head around all
Right.
at the same time. So I can definitely imagine how there's just a whole slew of things. And now look at you here. You weren't afraid of dying, but look at you now. I guess.
I'm like Gail, although she's saying she hasn't had it rough. I'm worried for you, Gail, because I hear what you're saying. But I have been the luckiest person, because I've been to other PNH seminars and workshops and things, and I am so lucky. Most of the time, I feel okay. I just feel very lucky. And at this point, I'm 73 years old. I'm going to die from something, and it may be related to PNH, but not really. Things are wearing out. That is true. That is one thing I remember my doctor telling me when I was first diagnosed, that everything's going to wear out sooner, because they thought I'd live 10 years, and that was 30 years ago, because your body is fighting this disease. and working harder. And it's an autoimmune disease. So, you can get flus and colds. And if I have one more vaccination, I'm going to scream. I've had every vaccination known to man, and I'm kind of done with that. I realize I didn't take as many pills as you guys might have, but oh my God, I feel like a pincushion.
Oh, oh man.
And I hate to be all about me, but I have to tell you a real quick story. So when you're on Ultomiris and I forgot, or Soliris, you have to take meningitis shots, right? So now there are two different kind of meningitis. So I had my meningitis A. I had that 2 years ago. Now it was time to get my meningitis B, and it's not a fun shot. And they gave me the wrong one. They call me the next day. They say, no, you've got the wrong one. You have to come back. So now I have two sore arms. I mean, they'll go away. It's not a big deal. But, I was so upset.
Oh, it's like on top of everything else, it's like
Yeah.
like the tipping point, right? Where it's like,
Yeah.
oh, I shouldn't have to do this.
Exactly. So
Yeah. Oh man. Oh man. And then you had mentioned earlier that you switched your infusion simply so that you didn't have to go as much, and it might not be quite as good, but it's good enough. And I'd love to just hear a little bit of your thought process. Like, how did you work that out with your doctors? How did that go down?
I waited a long time. I did not want to switch. One advantage of being mostly retired is going every 2 weeks was not as big a deal. I have a wonderful group of people at the at Mercy Hospital, since you might know it, Jordan, and in their cancer infusion center. They're the nicest people. I know everyone by name. I take them Christmas gifts, and it's like a community for me. So now I kind of miss going. They were my support system. I could talk to them in a way that I can't talk. New husband, by the way. I won't go into all the stories about how bad my first husband was when I was diagnosed. But anyway, this one's great. But, I can't really share with him what it's like to go through this, whereas the nurses, they listen and they understand. So I'm lonely. I miss them. But I really made the decision because I wanted to have more time to travel. Because I'm on Medicare, the cost didn't matter. It had nothing to do with the cost.
Gotcha.
But really it was to give me the opportunity. But I just think I'm more tired than I was on the Soliris because you're not having it as often. I've only been on this medication for less than a year. They promised me if I want to go back, I can. So I'm just going to give it some time and see. My headaches are worse on Ultomiris than they were on Soliris. I don't know if we're going to go into some of our other aches and pains and issues now, but, I have some issues being on Ultomiris, but not serious because I can deal with them, but
Gotcha.
they're not fun.
Gotcha. Okay. Thank you for sharing all of that. And then Selena, now that you have your little visitor, we'd love to hear about, I know the bone marrow transplant was really a feat, so would love to hear about that.
Yeah, so I first started having symptoms December of 2021. And that's when I had gone into my PCP, and we did do a blood draw at that check. And surprisingly, my levels were significantly lower than any other routine blood work I had done. But for some reason, it just never raised flags for my doctor. And so I went quite a few months after that time, and then I had much worse symptoms. I was getting the severe bruising all over my body, the fatigue, just not feeling myself. I'd get really bad heart palpitations. I'd be feeling weird and fainty and lightheaded at work and just all those symptoms. And so I finally went back and had my labs redrawn, and that's when everything was so low and my platelets were at an 8. And so I had to go to the emergency room and get blood transfusions, both blood and platelets, because everything was just very, very low. And then from that point on, it was basically weekly. I was blood transfusion dependent until I decided to do the bone marrow transplant. And because of how severe I was, that's what kind of pushed me to do the transplant sooner than other routes. And with that, it's a whole ordeal. And where I live is Spokane, and they don't have a transplant facility here. So just alone to do the transplant, you have to travel quite a bit. So I went over to Seattle to Fred Hutch, and that's where I had my transplant done. And with that as well, it's like a cancer treatment, but even just all the things. So chemo, radiation, ATG. So you have the physical side of losing your hair and, not looking like yourself, and the sickness from chemo and the body aches and the pain from radiation. So it's a lot. It's a lot on your body mentally and physically. But I also don't regret doing it because now I'm able to say I'm living a cured life. And I can be completely medication free. So even though it was a very long year of recovery and going through all of that, it was definitely the best route for me.
I have a question. I also went to Fred Hutch because I was diagnosed in Seattle. And I
Oh,
think it's, I participate in their long-term questionnaire.
hmm.
And when I've read, I'm just so happy for you that you're not taking all those medications, because I now feel I was lucky that I didn't have a much match for a bone marrow transplant, because it sounds like such an awful thing to live with because of the concern over rejection. So I think it's great you haven't had that issue.
Yeah, yeah. Which is definitely, there's GVHD that's still a concern in the back of my mind, things like that, that could happen. Because I know the first 3 years, sometimes people can be GVHD free and then all of a sudden have it come later on. So yeah, that's totally been in the back of my mind still, but I try not to think that way.
Sorry.
I have a question for Selena. Do you know the percentage of your match? Like, how much of a match were they to you?
Yeah, so my donor was actually my dad, so he was a 50% match.
Oh,
Okay. Oh, cool.
And that was my third attempt at finding a donor. My brother was first the choice because he was 100% match, but he ended up getting ruled out for like a random thing that made his blood just not, that might have caused rejection. So unfortunately he was ruled out even though he was 100% match. And then another really rare thing that happened is my cousin was a 50% match. And so they were going to do him, and then he also got ruled out for something that had happened. And so then they're like, well, let's check your parents. Are both your parents alive? I'm like, yeah. And they like, okay, let's start with your dad. Let's see how he does. And he was a 50% match, and he was super healthy, and everything worked out really good. So he ended up being my match.
Oh, that's awesome. Yeah. So you
Yeah.
didn't have to, did you go on the registry or look on?
They were about to, if my neither parents were going to be a match, then that's when they were about to go to the worldwide match. Yeah.
Gotcha.
Have you explored that route, Brandi, at all? Or
Yeah, yeah. That was one of the plan treatment options that we had looked at, was possibly a bone marrow transplant. And it's really cool to see Selena's journey, because my future, I don't have kids now, I'm not married, but that's was my worry, was, wanting to have kids one day and wanting to get married. How will that look? You don't want to walk into a marriage with all these health concerns, but it is what it is. So like, how do you do all of that? So it's really cool to see to Selena's journey. Thankfully, I was able to freeze eggs. So I'm really thankful to have that too. But that was my worry, was just really, what does the future look like? Just because I was so young. So
I
looking at a bone marrow transplant, yeah, I definitely looked at that.
So my first husband, it just got to be difficult for him accepting my illness, and so that ended our marriage. But I'm married now, and I have been married for 21 years. And my recommendation is, you talk to that person, and if they accept you for that, then they know and they understand. And also find someone who loves you even more than you love them, so that they cater to your every wish.
Oh, that's good advice.
But
Thank
it
you.
does. I mean, there are men out there that they understand and they love you enough that they'll stick by you.
Yeah.
Yeah, my
Thank you.
husband's wonderful. Yes. He was
So
in
it's always great to
yesterday.
hear.
He went to the emergency room for my uh, infusion of the platelets, and he was just like trying to help me do this, and I'm like, I can do, I'm in the back of my head, I'm like, I can do everything, I'm fine, but he's just trying to be all helpful and everything. So
That's always
I love a
nice.
supportive community around you, whatever that looks like for you. We did actually have someone who submitted a question about pregnancy and PNH, and since we're kind of like, I'm jumping around now because I had other questions about treatments, but since we're kind of on this topic, I know obviously Selena's our living our living proof right here that it is possible. But would love to just hear, kind of that thought process, even with if you're open to sharing, Brandi, like how did you get to the point of deciding to freeze eggs and who brought it up? Did you, did the doctors, for anyone who might be curious, and Jeri too, for just overcoming all of the I don't know the right way to say this, but just you had a lot to overcome when you found out or diagnosed and you had to unfortunately end that pregnancy. And then Gail, any insight that you have as well? So I guess we'll start with Selena since she's literally carrying her baby in her arms.
Yes. So yeah, that was definitely a concern for me as well. I did go kind of that route as I did talk to specialists about freezing eggs, and seeing kind of what they thought. I just didn't really have much time, I suppose, because I know it's not something you can just, oh, next day, like go freeze your eggs. Like that's not something you do. It's a long process. And they just didn't think that I was going to have much free time to wait to do that process. And it was kind of a risky operation as well because my platelets were so low. There were weeks upon weeks where my platelets would be at a 3 or lower. And it was just hard for me to even keep that transfusion in me. And so they were like, yeah, we don't know if it's the best route. Like, if you really, really want to, like, we can try. But if you're wanting to do this bone marrow transplant, it's probably better for you to start that first. And so that's what I did is I really thought about it. I prayed about it a lot and just felt that, doing the bone marrow transplant first and focusing on my well-being was more important. And then I had talked to another specialist in Seattle, and she was talking to me about how more statistics that as long as you're around like that 25-ish year old range, like she's been seeing a lot of success with women who had a bone marrow transplant and are been able to have kids. And at that time I was 25, so it was perfect hearing that news. So yeah, and then I waited until the 1 year after transplant. They wanted you to wait, be off medications, things like that. So February would have been my 1 year last year, 2024, so 24. And then March I got pregnant. So it was very fast.
And here you are in April of 2025 with a 4-month-old.
Yes.
Amazing. Go ahead, Jeri.
I didn't know if Brandi wanted to share something more before
Oh
I
yeah,
moved.
I'll definitely share. For me, as far as freezing eggs, so when I was diagnosed with both aplastic anemia and PNH, we were looking at all the treatment options, ATG again, a possible bone marrow transplant, and so we looked. I have two sisters, so they tested both of them. My doctor was telling me that they wanted a higher percentage of a match at the time, so we
Me
were
too.
looking like a 90% match.
Oh.
And both of my sisters were around a 60%. And so we decided to open up and look on the registry as well. So kind of like Selena, my doctor was like, well, since we're now looking on the registry, let's go ahead. If you want to freeze your eggs, this is the time to do it. It'll buy you some time because it may take a little while for us to find somebody on the registry. And he knew, that was one of the shared decision makings for me was he knew that my future was always what I was always thinking of. And so, here in Alabama, I froze my eggs. It was a process. Like you go and you have to take all the shots, and so it's so funny because in the beginning I could not give myself the shot, and so my dad would like go give me the shot, then he'd like walk in the other room and cry.
Oh.
Um, but it was really cute. I have such a supportive family, and I'm thankful for that. And also, like Jeri said, just having a supportive community as well. The people at the hospital are just so supportive of what you're going through. So they would like help us out with all the finances of getting everything just because they knew it was for a medical condition. And so they would help me and try and give me samples and things like that. So that was awesome to have that support financially as well. But thankfully I was able to freeze 13 eggs, which is amazing. And So that kind of put that out of the back of my mind. So then I felt like, okay, now I can focus on what I need to focus on. And so we decided to take that route of an ATG treatment from there.
Gotcha. Gotcha. So the that's so amazing that you had the support from the hospital too. So they were able to help you financially for the egg freezing process because it was because of a medical condition.
Yeah, absolutely. Yeah. So that was that me and my family were thankful for that as well, just
Yeah.
because, you're always thinking of the finance part of everything, of how are we going to do all of this. So to have that community and that support of them knowing what I was going through, and them helping as much as they could and giving discounts and stuff like that really helped a lot.
That's amazing. Just for anyone who may be considering, but finances are maybe a blocker for them, that could be an option. So thank you for sharing that.
Yeah.
I wanted to share a couple of things to the other people in that are watching that may or may not be going through some of this. One thing that I I battle a lot with problems with abdominal pain. It'll come on me. It's episodic. It comes and goes. Can't really count on it. And so I take Vicodin or Norco on a regular basis. I probably go through 90 pills in 180 days, which is still sounds like a lot to a lot of people. But I'm cheering this because, I mean, my doctors understand that I know how to control it. I guess I'm addicted in the sense that I do need it, but I think if you're having a problem, I just want to say, make sure you share with your doctor. And there's so much discussion about opioid overdose and problems that some people are afraid to share their pain meds. And when I have a lot of pain, besides just staying in bed, there's nothing I can do. I can't eat, I can't sleep because I'm in pain. I'm just miserable. So the opioids help me get through those days and live a normal life. So I'm willing to do that. I get monitored and it's fine. So I wanted to share that. The other thing is, and since I'm the only one right now on a regular infusion, if anyone's considering going through infusion, think about getting a portal. Now, if you're on Ultomiris, it's not as important because you only go every 8 weeks, but I was going every 2 weeks. So I have a port right about here. You can see it. There's a little mark you can see, but you can't really see it. I mean, I'm not that vain. I don't wear a bikini that often, even in San Diego, so I don't care. But the portal made all the difference for me, because if I thought I had to get pinched and poked every 2 weeks with an IV, I couldn't have dealt with that. But just emotionally, that would have been hard. So those were just a couple of things I want to share from my journey that make my life better. And that's what I'm all about, is enjoying each of my days as much as I can. Well, that was one other thing I learned during going through this process, is I no longer procrastinate as much. I was a great procrastinator and said, I'll get the work done tomorrow. I'll come in early tomorrow and get the work done. But then I learned that because for me, the PNH is episodic and sometimes I'm in pain, sometimes I learned I can't do that. If this is a good day and I have things to get done, whether it's work or personal, I get it done, because maybe tomorrow I'm just going to have to stay in bed. So I've become more productive maybe that way too. But yeah, I can't procrastinate anymore.
Yeah, that makes sense. It's kind of like just when you have the good days,
Right.
you're all in on those days. That actually is a good segue to, and thank you for sharing about the pain and how that still is something that you experience often. I would love to hear just how everyone does experience, or if you do experience any PNH symptoms, and what that looks like for you. So I guess we'll go back to Brandi. Or unless, Jeri, you had anything else you wanted to add on that front.
No, well, when I'm tired, I share I'm not a private person. So if I'm having a bad day and I'm around friends, I have no problem just telling them I can't stay any longer for this meeting or this event, or people know sometimes I'm just going to cancel on them. That is hard, because you make a commitment and then sometimes you have to cancel. But my friends now know that that's a risk in my life. So for me, sharing my situation helps in my community.
For me, the symptoms that I still today really battle with are fatigue. And that's one thing I've heard even from other PNH patients, is the symptoms haven't fully gone away for everybody. And so that kind of helped me even now in my journey now, just feeling less alone of, okay, the symptoms I'm dealing with are, I'm not the only one feeling like I'm only battling these symptoms. But fatigue is a big one for me. And that's just where I mean, my body is just like, you've got to rest. So I just literally, I'll lay on my couch or I lay in my bed and I'll give my body time to, I feel like it just needs to like rejuvenate and kind of take it easy. Um, so for me, fatigue is big, but also the brain fog. I'd say the brain fog is, I call it kind of like short-term memory loss. It's just like somebody will tell me something and 5 seconds later, I'm like, what did they say? Like I have no memory of it. So the brain fog is really hard. Even working, I have to make notes of just everything just to make sure I don't forget things. But the brain fog is a huge symptom for me. I still deal with some bruising, not a lot, mainly from the aplastic anemia side. That would be Those are my two big symptoms. Shortness of breath is a little bit. I actually have started working out again. And so I think that's kind of helped also with just getting the heart rate up. Um, even just a little bit of walking sometimes, just trying to get my body moving from time to time.
Sure. And what about you, Gail?
I would say my main thing is the bruising from the platelets because that's really the only level that's off in my blood work. I also have shortness of breath sometimes.
Okay.
Just I feel like I have to breathe deeply every once in a while. Like I don't know, need to get a good deep breath in or something like that. It's just different. It's hard to explain. And I have a lot of the just like the random numbness and tingling sensations throughout the day. That's probably my biggest one.
Okay.
It's nothing painful. It's just odd, weird
Gotcha.
sensations. So that's about it.
Gotcha. Okay. And Selena, do you feel any symptoms?
Sometimes I do feel like compared to before transplant, it's a night and day difference. I have less symptoms for sure. But it's kind of hard to know, especially now that I've also had a baby. I'm like, is that mom brain? Is that fatigue? Is it brain fog? Like sometimes they all just kind of merge together nowadays. But yeah, I do feel like I do get brain fog. Bruising here and there. It kind of just depends. I'll get my blood checked every once in a while and I'm like, okay, I'm a little low on platelets, lower. Definitely not in like, 3, 9, anything like that. But when a rare occasion it's like 120 or something, I'll get a little bit more bruising than normal. But everything else has been really good though.
Gotcha. Okay. And we did get a question. Someone who's listening, they said that they found that they get scarring on their legs that doesn't heal, and it's not just bruising, but scars that never go away. And they're curious if this happens to anyone else or any of you, and if you found a way to deal with it.
I actually have been dealing with that kind of through diagnosis and even still today I actually notice that whenever I will like shaving my legs, I'll like nick my legs every once in a while and I feel like they just don't heal as good as they used to, which is so strange. I haven't found anything that's made it better, but my legs definitely they bruise a lot easier. I'll get weird little scarring on them and they just kind of stay that way, and like discolorations. I'll have kind of like white spots or things like that, and I haven't asked a lot of the doctors about it. But I just really try to keep it moisturized and try to stay out of the sun with my legs as much as possible. But yeah, it is a really weird thing and I don't know what causes that either.
Interesting. Yeah, maybe we'll have to get Dr. Dingley back and ask him about that. He's always so great. Um, I know we're kind of nearing the end of our time. I did want to ask, I guess I'll kind of like open it up if anyone wants to share. When you look back, is there anything that you wish you knew before you started the treatment that you took? And just an open question to anyone who wants to answer, if you want to answer.
I don't think I'm thinking. I guess I didn't know what I didn't know when I started, and of course, you're so scared when they've just diagnosed you with this deadly disease that they didn't know what was wrong with me at first. And so they kept doing all these tests, and even after the bone marrow biopsy they didn't know right away. And so I was just so grateful I was so happy to know I had aplastic anemia because they had a name for it. And so I was relieved to know they had a name, and then we could come up with a treatment and we could have a process. So for me, I just went in blindly. The ATG, again, remember this was 40 years ago. They had no idea if it would work. I was in the hospital. I was on the high dose of prednisone with the ATG, and this other woman was on the low dose of prednisone, and she didn't make it, but I did. And I went through all of these, why did I live and she didn't? That was really hard. I will admit that. This other woman had 5 children and a husband and all this life, and she didn't make it. And I felt so guilty because I did. I took a long time to get over that, but I was just so glad to do something and have a diagnosis that I don't really think I needed to know anything more. Just put me in the hospital and start something.
I'd say mine is kind of similar to Jerry's. Yeah, when I was first diagnosed with aplastic anemia, it took a minute for them to actually give me a diagnosis. So during that time of not having a diagnosis, I was just so worried about what is wrong with me. Like she said, just knowing, okay, now we know what it is that's wrong with me. That really helped. And then being diagnosed with PNH, it's funny because my doctor was like, okay, we see you're out of remission with aplastic anemia. She's actually an oncologist, and she was like, I've just done research and found that aplastic anemia patients are sometimes also diagnosed with PNH. I want to do a photometry test. And her words were, I don't expect it to come back positive or anything to be wrong, but we're going to rule it out. And then, you get that call that night or the next day of, hey, you also have PNH. So my worry at that time was just trying to figure out, how do I fight 2 illnesses at once? Like, that was my thing. So I feel like you don't know what you don't know, but you learn along the way. And I'm thankful for all the support that I've had to help me get to that decision making of treatment options and getting blood transfusions and platelet transfusions. Really just leaning on other people to answer my questions. I'd say that really helped me.
And remember, when I was diagnosed in 1984, they didn't have the internet. So there weren't all these places you could go to do any research. They didn't have any of these organizations that you can now count on to give you information about PNH or aplastic anemia. So I was totally reliant on my doctor because there was no place else to look. I just had to hear from him what was going on. So that's a difference also in when I was diagnosed to the 3 of you.
That's true. That's a good point. Sometimes it's like, is there too much information or not? Can be information overwhelm. And then last question that we got from a participant is, this is a very broad question, so we don't have to answer specifically. It's what's the best way to get access to newest therapies, and that's very dependent on a lot of things in your personal life. But I would just say for you four, if you have any tips on, like, do you ask your doctors? Do you do research, or like, where do you find if there is something new that you should be exploring?
Well, I'm a member of AMDS. I belong to 2 or 3 of the not-for-profits that do research on these orphan diseases, these rare diseases, and they kind of let me know. That they'll send something out and ask me if I want to be part of a research study, which in my case wouldn't make any sense because I'm stable. But so I'm learning all these things. But primarily, I would rely on my doctor to hopefully tell me if there's something out there.
Yeah.
I relied on my doctor. My caregivers were my parents. So for me, at the beginning, I didn't want to research. Now I'm much better, but I just knew I get so in my head and I'll be diagnosing myself with things that's not true. So my parents in the beginning did a lot of the research for me and getting that information. But we did both. We did our own research, but also relied on our doctor and would go to my doctor with questions. My parents would have a binder full of questions.
Good for
So
you.
we did a little bit of both.
I also agree. I did both as well. I kind of was the one who am like the researcher and I like to, Google everything. But because of that, that actually helped lead me to getting diagnosed because without that, I probably would have never gone to the doctor. Because of all my symptoms I kept having, my initial doctor kind of dismissed me. So continuing to do
Mm.
the research on my own, that led me to, being seen again. So I definitely recommend just doing a lot of research yourself because a lot of doctors are different too. Like some doctors are more old school with things and they're so focused on the ways that they've always done stuff that they're maybe not as open to the newer advances that we have. So it's good to ask your doctor. My doctor was really good and he gave me a lot of different options, but I think it's good to do both.
Yeah, my doctor, I'm her first and only PNH patient, which probably a lot of people are, but she told me she didn't know a lot about it. And so she did refer me to Dr. Dingley, and, they communicate, and we've learned together, her and I, different things. So if I see anything interesting, she wants to know about it, and vice versa. So
Yeah, it kind of ties back to like, when you're the one experiencing it, you're the one who knows it through and through. Like, like we have the research, but that's part of what we aim to do at Folia too, is just uncover like, hey, maybe this scarring is actually something that is part of PNH that we just don't know about yet because we only know what we know, right? So yeah, it's just the world that we live in. But I know we've taken up so much of your time. Thank you, ladies, so much for sharing your stories, for being so open with us today. I know it's been so helpful, so informative. We really appreciate your time. And then to everyone else, thank you for joining us today. We will be sending out the recording and a recap just if you want to go back and just go back to any part of the talk at all. And again, if you did want to sign up for the study, we will include that link in the follow-up email and with the invite code so that you can join the study, which is, it will be panel. So we didn't get too creative with it. But anyway, have a great rest of your day, everyone. And thank you again, ladies, for joining us.
Bye.
Thank you.
bye.
Thank you.
Thank you.
Bye.
Good luck, everyone.